So hi everyone, I'm Erin Martin. I'm a gerontologist. I have a master's in aging services management from the #1 school of gerontology and the only freestanding school of gerontology in the world. I am the director of FreshRx Food as Medicine, Oklahoma, and the president of the Tulsa Urban Ag Coalition. So we're targeting the food desert in North Tulsa, where people are dying the most from diabetes. Of course, you all know that diabetes is the 7th leading cause of death in the state of Oklahoma. And 5 zip codes are where people are dying the most. And 3 out of 5 of those zip codes are in North Tulsa specifically. It is a food desert. It did not have a grocery store until this year, and it didn't have a grocery store for 14 years. The difference in longevity from someone in North Tulsa versus South Tulsa is 11 years shorter if you live in North Tulsa versus South Tulsa. There was a doctor, Dr. Farish, who works for Crossover Health Services, that saw all of his patients are not having success with their diabetes, and they're uncontrolled, which means their A1C is over 8. He saw that everyone was being compliant in their practices with the clinic, so taking their medications, coming to their doctor's visits, and what he saw is that there was something called social determinants of health, and that were not being addressed. So he reached out to the Tulsa Food Security Council and had heard about a produce prescription program called Fresh Food Pharmacy, where it was estimated that if they could reduce someone's A1C 1 to 2% in the year, that they could do that in a year with fruits and vegetables and education, and it would actually save $16,000 to $24,000 in healthcare costs per person per year. So some of our partners, we're all locally funded, so there's 200 produce prescription programs in the United States, and they're all locally funded. So we'll talk about that. We'll talk about what the program entails, who our partners are in the community. Some of our funders are Morning Crest Foundation, Fazell Family Foundation, Ascension St. John's, Walmart, and the Commemoration Fund for Zero Foundation. They are specifically targeting health equity and racial disparities in health. Some of our partners are the Oasis Fresh Market. So in North Tulsa, we do our distribution sites from there. We have 50 participants currently, and so they get every 2 weeks, they get local regenerative food that's nutrient dense. And I'll talk to you about why that's so important, about why and how we're sourcing this food, and how we have quality measures to account for where this food is coming from. The other component is not only the food, but is the education. So we have nutrition and cooking classes every couple weeks, and cooking demos in person. They all got iPads, and we displayed those and recorded those food cooking demos so that everyone can see them. And if they don't have internet, it doesn't matter because they're uploaded to those iPads. And then the third component is the health outcomes. So every 3 months, we monitor blood pressure, A1C, and their weight, which is super duper important, and we get to see how everybody's doing. And so we've had some incredible health outcomes. What has happened is we have seen people go from uncontrolled to controlled in less than 6 months. We've had 18% of our participants in the first 3 months go from uncontrolled to controlled, and then in 6 months, 23% have gone from uncontrolled to controlled. We really need to understand is over the last 50 years, our soil has depleted significantly because of conventional types of farming. It's reduced our mineral and our nutrient density in our soil, which translates into health. It has reduced it drastically so that as we have become more deficient in our mineral content in our soil, which then translates to the food, that has incredibly depleted our food. And that has direct links to chronic conditions and the increase in chronic conditions. So you can definitely improve people's health with fruits and vegetables, absolutely. But how we are ensuring that nutrient density is more significant is by how we're sourcing this food. So actually, if you just go ahead and click through there, that's one of our cooking demos. You can keep going. Yeah, I was just gonna show it for a second. So we filmed these, they're on their iPads, and we have Dr. Nancy Grayson of American Heart Association. She worked for them for 30 years, who teaches those cooking demos. And then you can go ahead and go next. And then here's one of our farmers. So we not only are sourcing local food and creating jobs and stimulating local economy, but our farmers are underserved farmers. Our farmers are of color, they are minority as in women, they are veterans, and they're underserved farmers and local to Oklahoma. So we have a cohort of about 20 farmers, some in Tulsa, some in Oklahoma City, some in Joplin, and some in Fayetteville. And we'll go through some of the challenges as well. But the big piece is that not only are they local farmers, which means if it's local, it's going to be more nutrient dense, because when things are shipped, they lose nutrients. So on average, a tomato will lose up to 30% of its nutrients within 72 hours. So if it's not local, it's not nutrient dense. The doctor who stimulated and initiated this program, he wanted to source it from Amazon or the food bank, which is fine. But if we want to make sure this food is medicinal, it needs to be local so that it maintains its nutrient density, so it's more fresh. And then also that stimulates our local economy here in Oklahoma. We do have a food capacity problem. So people said, you're going to source all your food locally? How are you going to do that? How are you going to do that? And how are you going to do that through the winter? And I said, watch me. Our farmers grow in a regenerative way, which means it's beyond organic. They are sequestering carbon back into the soil. They have biodiversity in what they're growing, so they do not monocrop. They are making sure the water is infiltrating because they are not disturbing, and they're using cover crops, so they're not disturbing the roots. So there's all these other practices that is beyond organic. So that's something we have to understand, is that even if it's organic and whole foods, it doesn't mean it's nutrient dense. So what's great about this is the farmers not only are invested in this because of the health outcomes, but they can feel confident in expanding, knowing that we'll help them expand and try new crops, but then we'll buy that from them. So we also secure that their regenerative, nutrient-dense food goes to market in some capacity. And we could go to the next one as well. There's a couple more of our farmers there out of Edmond, Oklahoma, Alaric and Greg, if you could keep going. And so here's nutrient density. We've partnered with Bionutrient Association, who is doing tests and actually has a meter that scans food products to say how much nutrients are in each item. And what they've found is they've established a continuum of bionutrients in variations. So as you can see a little bit on this chart, is that nutrients varies drastically by where it's grown and how it's grown. So obviously grapes, they vary 15 different times. Spinach can vary from 1 to 365, which means you would have to eat 365 of the least nutrient dense spinach that would equal to 1. So how inefficiently are we eating? And so this actually puts the power back into the consumers so they can see exactly, oh, I scanned this spinach, this doesn't have very much iron in it, and I go over here and this has way more iron in it. So we're actually partnering with Dan Kittredge, who invented this meter, who works for Bionutrient Association and founded this about 10 years ago. His meter is out, it's still being perfected, but we are sending, some of our farmers have sent in their food products to be tested, so they are in this study as well. You can go to the next slide for me. So again, sourcing is very specific. It is not to downplay anyone providing food for people that are in need, but how we make it medicinal, how we ensure these incredible outcomes is through how we source. So not only are we working with Bionutrient Association, but we're working with Regen Ag Labs that runs the Haney soil test. Dr. Rick Haney invented the Haney soil test. He worked for the USDA for about 40 years, and they're actually using that test through Regen Ag Labs, which is one of the largest labs that runs testing for regenerative farmers specifically. And so now through Soil Regen, there's a regenerative certified trademark where we're actually using the Haney soil test to verify that they're actually regenerating the soil. So we get to measure from 0 to 6 inches to 6 to 12 inches and compare and see if that topsoil is increasing in an organic soil matter, which is going to directly translate to how nutrient dense that food is. So it's super exciting, and that is a key component to how we're able to actually provide medicinal food. The last thing we want to do is give sick people more poison. So we're not interested in doing that. And we also partner with Jimmy Emmons, who's here today, and Trey Lamb with the Oklahoma Conservation Commission and the Oklahoma Association of Conservation Districts to do soil testing and consulting and provide technical assistance to our farmers. So we can go to the next. So some of our health outcomes, we started with 52 participants. Our budget was $150,000 to feed 50 people for 12 months and provide education as well and monitor their health outcomes. We were able to do 52 because we had 2 people who were couples, so we were able to do that. In 3 months, as you can see, we had 16% go from uncontrolled, which would be an A1C over 8, to below an 8. After 6 months, we had 23%. And again, this does not account for people who went from a 14 to a 10. They just didn't fall below an 8, so they're still considered uncontrolled. The reason why there's so much cost savings to this is because when you're over an 8, you're more susceptible for a catastrophic health event, whether it be a stroke, heart attack, amputation, kidney failure. So after 6 months, 47 people are still engaged, which is absolutely incredible to me. And 31 out of those 47 people have seen a reduction in their A1C, whether it was 0.1% or it was 2%, or we've even had someone go from a 13.6 to a 6.5, lose 30 pounds, and come off of half of their medication. And so if you use that range that was proven by the Fresh Food Pharmacy, as you can see, a 1 to 2% reduction equates to $16,000 to $24,000 in healthcare cost savings. Our average reduction through those 31 people is 1.98%. That means we've saved $750,000 in healthcare costs, and that's just with 50 or less people. So they have estimated if we paid for fruits and vegetables at a national level, we would save $1 billion in healthcare costs. We can go to the next. So here's some of our participant comments. Started the program at around 253 pounds, lost a chunk of weight down to 229.8. Thanks, FreshRx. Erin Martin and FreshRx are my heroes. I want to thank you for providing fresh veggies and fruits to those with diabetes and to help those diseases that plague our communities. This morning, I learned my A1C is a 6.6. I'm so over the moon with this. Transitioning from so much meat and carbs to learn how to eat and cook with veggies has been very new and eye-opening. It takes time, but we can do it. Thanks, FreshRx. And so here's a video of one of our participant success stories with Channel 6 in Tulsa.
A Tulsa woman says access to locally grown fresh fruits and vegetables is really improving her health.
She participates in the FreshRx food program and tells News on 6's Sawyer Bussey she's already seeing an improvement in her diabetes numbers.
Well, you got a lot of colors there.
Oh yeah, that makes it pretty. That makes it pretty.
Welcome to Deborah Cooper's kitchen.
And put my peppers and onions in first. Like I said, they don't make you feel like you're getting a handout. It's like come and get some longevity. Yeah.
It hasn't always been this way.
I was best friends with Little Debbie and her snack cakes.
Deborah says unhealthy foods were also friendlier to her budget and at times much more accessible than fresh local produce. Over the years, Deborah's sweet tooth started impacting her health. She was diagnosed with type 2 diabetes in June, and as a patient at Crossover Health Services was connected with the FreshRx team.
Our body can heal itself if it gets what it needs.
FreshRx is partnered with Oklahoma farmers, community partners, and patients at Crossover Health Services to bring fresh, locally grown produce to 52 participants with dangerously high A1C levels and type 2 diabetes.
Food is medicine, and it has this huge ripple effect.
Deborah is one of the FreshRx participants. In less than 11 weeks, her A1C levels have gone from a 10.6 to a 7.1.
They gave us all of these recipes with the items we were picking up. So that's like you gave me not just a car, but you gave me the keys too. I have even passed up Debbie. I see where they set them out. I just hold my head up and say, girl, bye.
Deborah is a pastor of a growing ministry, and her physical health is starting to match her spiritual health. She says the same results are possible for others.
What I'm called to do, I want to be here to finish it, and I want to do it in excellence. And this program, it is life-changing.
Real outcomes, real food, real people.
Sawyer Bussey, Oklahoma's own.
You should have your own cooking show.
News on 6.
So as you can see, we've had just some incredible health outcomes, and I think that's what stands us apart from other produce prescription programs, is that our food is nutrient dense, and we have a way of understanding how that is and measuring that. So produce prescription programs, there was a field scan report. Like I said, there's been about 200 of these programs, a lot focused on type 2 diabetes, as that's something we've accepted more as something we can reverse with diet and exercise. So this kind of highlights, and I'm happy to share these documents with you all. They're large documents, but this goes over how all of them kind of differ and how a lot of them are the same. Many of them are, like I said, are associated with type 2 diabetes. They have some kind of hybrid version of education plus food. So that's how these things work together. Now, the problem is, or the opportunity, I like to say, is that they're all locally funded, which means we have to find a funding stream for these programs. So if you go to the next slide, this is where Harvard and the Rockefeller Foundation produced a policy strategy report. I think there's about 11 policy recommendations on how to get this implemented in your state at different levels. And there's 2 states, North Carolina and Massachusetts, that have passed waiver programs at their state Medicaid level, which doesn't necessarily mean they're produce, from what I understand, not produce prescription programs, but really associated with food insecurity, which of course that's something that we're tracking. Another thing we're also tracking is mental health and quality of life. So 60 to 70% of our participants have been diagnosed with anxiety and depression, and we're really monitoring how that helps with their stress level, reducing their stress level, and also improving their quality of life and their connections with their loved ones, being able to spend time with their friends and family. So we're really tracking as much as we can. If you go to the next for me there. So in 2019, there was a task force for the future plan of aging in Oklahoma. I was able to make a public comment and was also asked to come back and give a 30-minute presentation. It was held at the Healthcare Authority. This was published obviously right before the pandemic in November of 2019 and distributed to all the legislators. And I did quote in here, "Let food be thy medicine and medicine be thy food," that we don't just have the opportunity to optimize health and aging in Oklahoma, we have the responsibility to do so. We have the privilege to leave a legacy to our children and grandchildren as they live and age. And it was through my studies and my understanding that disease is not a natural part of aging. We have this understanding or this belief, because it's become normalized, that we get a disease and we die. And that's actually not true. In the blue zones of the world, people die of something called old age on 0 prescription drugs. If you're 65 in the United States, you're on an average of 15 or more prescription drugs per year. And if you're 50 years old in the US, you have at least 1 chronic condition. And I believe through my studies and my understanding and my own personal experience that food is the ripple effect. Food is medicine, and that's why Hippocrates stated it this way. So thank you all so much for having me. I'll take any questions, but I'll be here after. So again, sourcing is a huge deal. It not only stimulates local economy, but it supports these farmers who are the true longevity heroes. So thank you to Senator Hicks and Representative Bell, and for all of the champions, and thank you to Jimmy Emmons and Trey Lamb for being here as well, and from Secretary of Ag's office as well. Thank you very much for being here. I think that we can all unite ag, healthcare, long-term care, and rural areas to really stimulate some incredible medicine coming from Oklahoma. Thank you. So eating seasonally is very important. It correlates with a lot of different things that's going on in your body and your environment. And people say, oh, you can't grow year-round in Oklahoma. Well, that's actually not true. People can use high tunnels and other kinds of things to grow year-round. There's something also called wallopinis, where they grow citrus year-round underground. So we want to make sure the food's seasonal because it's going to be more nutrient dense. We do have correlating recipes that come with each item. So we have a new item on deck or in our distribution. We make sure there's a recipe with that and do correlate it seasonally. So I think that's a really special component. And that's why we also work with the USDA and the NRCS to make sure that our farmers are equipped to be able to go through the seasons. Now, we saw a lot of greens during the winter, and so we did supplement with like rice and beans that we actually got locally. Chia seeds, flaxseed, mushrooms, microgreens that can be grown year round. So we do supplement when we need to, but we've actually been able to do it all year round and to do it seasonally and have correlating recipes. So I think that's a really good question. I think that any type of food program or a tool to be able to learn how to cook and use things and be able to look at a recipe and cook, I think that's all positive from the get-go. Now, are those things sourced locally? Are they nutrient dense? Will they be necessarily medicinal? I don't know. And then obviously there's other components of what type of things are you picking in those things, and are they causing more inflammation or not? So I think any type of program is good at the bare minimum, but can we be doing a ton better? I think that's really important. So if it gets people cooking more at home, and then that's the bridge to then going to your farmer's market or subscribing to a CSA, which is a direct subscription to a farm, and getting more nutrient dense food, then I'm all for it. Whatever is going to work for you. Like obviously if you're not going to do a certain thing and that's not going to work, then that's not going to work for you, and that's individualized to everybody. So I think as far as people can go with it is great. And so again, it's a good tool. It's just understanding and being conscious, like, okay, this may be something that's doable for me because I'm busy and this is what I need to have. But I think it's also us creating more infrastructure locally that gets delivery, or there's pickup sites, and creating those hubs and expanding those hubs even more. So we have a hub where all our farmers bring, and then we set it up as a farmer's market so people can come to one location. And then we've done some delivery as well for people that don't have transportation. So again, I think those are great, but we also want to create more infrastructure so we can have those same kinds of services, but locally. There is a local farm, Oklahoma, and they aren't all local. They're focused on local, but they've also, because of capacity problems, had to go outside more regionally, and they do delivery and have like a subscription-based model. So they would be a great transition from some of those other subscriptions.